Good afternoon, and thank you for joining us for the Friday edition of the London Virtual Media Briefing about COVID-19 in London and Middlesex County. As usual, we are joined today by London Mayor Ed Holder and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. We invite the media to submit their questions in the question and answer forum, and you can find the link right here on the Microsoft Teams platform. And we also welcome those tuning in on Rogers Cable in London, also those watching on the Rogers YouTube channel, as well as Rogers Facebook page, to listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's get right to today's opening statements. We'll start with Mayor Ed Holder. Mayor Holder.
Thanks, Dan, and good afternoon, everyone. Look, there's no way to put it. April was a painful month for too many London families and London business. According to employment figures just released by Stats Canada, this is a pain that's been felt across the province and across the country, but it's dramatic. And the numbers of job losses this month really speaks to the challenge that we are all dealing with in these unprecedented times. And, you know, that way we're also living in a time of unprecedented change, and for a number of Londoners, unprecedented fear and anxiety. That's both economic and social. But there's also a time of unprecedented support. You know, for the last several weeks, the Mayor's Economic Impact and Recovery Task Force and the Mayor's Social Impact and Recovery Task Force have been meeting on a near daily basis. This is a Team London approach. There's no partisanship, no ego, no time to waste. We're committed to providing supports for Londoners, not just now, but in the weeks and months ahead. These groups are comprised of more than 200 individuals, agencies, and businesses, along with regular attendance by members of council, members of parliament, and members of provincial parliament. Our first summary report, released 1 month ago, contained 32 ideas for action that came as a result of those meetings. And you know, we delivered on most property tax deferrals, assistance for London's most vulnerable, rent relief, and working with senior levels of government to make sure the needs of Londoners are being considered and acted upon by the Prime Minister and the Premier. Now, our latest summary report, our second, sees the focus shift from immediate impacts and works towards recovery. We have a number of other ideas towards action, and we look forward to working with our partners to see those ideas become a reality, just as we did with the first number of ideas, several dozen, in fact, that came through our initial report. A couple of other quick points, if I may. As we now know, the temporary ban on open-air burning is now lifted. So on behalf of the London Fire Department, I'd like to thank Londoners for their patience, their cooperation while the ban was in effect. Now, there are still other provincial restrictions still in place. Physical distancing, we talk about it every time we have this press conference, which is daily, as well as limited gatherings to no more than 5. Particularly right now, as we come towards Mother's Day, and there's an inclination. So what we've said is, love your mom. Love her on the phone, Zoom love her, Skype love her, don't visit love her, because you want her around next year to be able to live again. And as a reminder, as of today, nurseries and garden centers are allowed to open. Starting tomorrow, hardware stores. Starting Monday, all retail stores with a street entrance can now do curbside pickup. That, despite the fact some of these services are starting to come back, and especially with Mother's Day, we ask you to continue what you've been doing over the last 7 to 8 weeks. Physical distancing, hand washing, coughing into your elbow, staying home if you feel sick. All of this progress we've seen over the past 2 months didn't happen by accident. We know these measures work, and you can take great pride as we ask you to remain vigilant. If not, the curve, which is flattened, will begin heading in the wrong direction, and we're back to where we started. You've worked too hard. Please, we're not asking you to do anything new or anything different. Just keep doing what you're doing. Thanks, and happy to turn this over to Dr. Mackie.
Thanks very much, Mr. Mayor. So beginning, as always, with the numbers, 2 additional cases here in London and Middlesex, and 1 death. Provincially, there were 477 cases reported, which is a fair bit of a jump from the last couple of days, but still fairly consistently downward on our 5-day moving average. The trend continues to be that the Middlesex-London numbers and the provincial numbers are diverging. We're really seeing the number of cases drop off here. It will bounce around a bit over the coming days with long-term care home testing, but the provincial numbers remain relatively high in comparison. We are getting a number of questions now about businesses and social settings starting to open up and how do people protect themselves. For example, the question of double bubbling or one family partnering with another, still being very careful to not have large numbers of interactions with others, but choosing a family to kind of partner with through COVID. At this point, the recommendation of the Middlesex-London Health Unit is that it's still not quite the time for that. There might be a place in the coming weeks when that does have a role to start increasing very slowly our number of contacts, particularly for families with kids who want to, would love to have playmates, but now is not yet that time. The other question that is pretty common right now with the opening of new businesses and the curbside pickup is what is the role of masks in that? Should people be wearing homemade masks or trying to get their hands on some kind of other mask that might help reduce the spread of COVID? First of all, the recommendation is neither to wear nor not to wear a mask. Essentially, the research is not strong enough in either direction to say that masks help or not. There's some likelihood that wearing a mask can help protect the people around you if your sneeze or cough is kind of caught in the mask. But it's important to note that wearing a mask doesn't necessarily offer very solid protection for the individual wearing it, and that regardless, mask or not, physical distancing remains an important part of keeping yourself and others safe. That's it for me for now, Dan.
All right, thank you both very much for those opening statements. Gentlemen, we do have several questions lined up, so we'll get to those right away. And Mayor Holder, the first question today is for you, and it's from Dan Brown at the London Free Press. Mayor Holder, is it somehow appropriate that we're marking VE Day at a time of sacrifice when Canadians are being asked to lend their efforts to a common cause for the literal health of the country?
Dan, there's no more important time to do this than to do this on what is now today the 75th anniversary of the cessation of fighting in Europe in World War II. Absolutely important. I say this as the son of a veteran. I say this as the nephew of a soldier who died literally months before the end of the Second World War in Europe. We have a privilege and an opportunity to say thank you. Look, over this last several weeks as we've been dealing with the pandemic, we have taken great care to thank our first responders, our frontline agencies, delivery people, cashiers, people who have made a difference in being able to maintain our lives. We would not have the life we even have today were it not for those people who put their lives on the line, who sacrificed their lives, sacrificed their commitment, their family's commitment. If there's ever a time we need to ensure that we say thank you to those people that give us the life that we have today, it is now. It is why with great pride at 3 o'clock that I will be at the cenotaph laying a wreath on behalf of London to acknowledge and thank our veterans. We will have a piper, and there will be one person with me, and that is all. But it will be streamed. It will also match and be consistent with the ceremonies right across the country. Today of all days, we will remember them.
Thank you very much, Mayor Holder. Dr. Mackie, the next question is for you, and it comes also from Dan Brown at the London Free Press. Dr. Mackie, are you encouraged by the relatively low number of new cases being reported daily in Middlesex-London in the past week? How close are we to the peak in deaths? Is the peak in deaths, like the peak in cases, only recognizable in hindsight?
Okay, some great questions there. So first of all, yes, it's absolutely quite encouraging to see our local numbers come back so low. Looking forward to the days when we start to see zeros, but now that we've been under 10 for some time, and again, that will bounce around as we go into more and more long-term care homes. But it's pretty encouraging to see those local numbers so low. And also we're testing as many people locally as we have through all of this pandemic right now. So probably about 200 tests a day in hospital, about 200, usually more than that, in the assessment centers, and roughly another 200 to 300 in long-term care homes, as long as all of the systems are going and swabs are available, which they are right now, which is fantastic. So the other parts of the question, are we close to the peak in deaths? Again, difficult to say. If you look at the provincial numbers and deaths, we still are climbing, again, provincially. Local numbers of deaths are a little bit too, they bounce around a little too much to be able to really see a strong trend there. But the provincial numbers are still showing a climb in the number of deaths, and that 5-day moving average of deaths is also climbing significantly as well. And you're absolutely right, Dan. It's as with the peak in cases, peak of deaths, you'll only know in retrospect. It's probably one that you can see sooner than the peak in cases, because the peak in cases has that delay between people getting first exposed, then symptoms, then getting in to get tested, and then the test results coming back. So that creates much more of a delay. Death is death, and when it happens, it's recorded right away. So there's less of a delay there in that data set. But as with cases, and especially because the number of deaths are so much lower than the number of cases, you will see those numbers jump around up and down day to day just because of random variability. So that's why we really do need to see kind of like a week or more trending downward in the death count in order to be able to call a peak for sure.
All right. And a follow-up question for you, Dr. Mackie, from Dan Brown at the London Free Press. Dr. Mackie, looking back to early April, with the grim provincial projections and LHSC building a field hospital to prepare, is the trajectory of COVID-19 in the London area more favorable than you had anticipated?
Well, it's more favorable than the provincial projections anticipated. It's actually right in line with what I thought would happen here. And the difference is the provincial projections were using mathematical modeling, which is, by its nature, you have to make a number of assumptions in order to predict cases and deaths. And instead of the mathematical modeling approach, which is really kind of creating the model out of thin air from various data points and also lots of assumptions that really are judgment calls by the modelers. What I did is I looked at Italy and as kind of a worst case scenario. And if you took because at the time, this is about 2 months ago now, if you took, Italy was the worst case scenario in the world in terms of deaths when it crossed over above China in terms of the total number of deaths. And what I did is I took Italy's numbers and applied them to our population in sort of a per capita way. So the number of per capita cases and deaths in Italy versus the number here. And actually what we're seeing here is much more in line with the projections based on using real world data rather than the modeling. So that's really speaks to the strength of looking to actually what has happened in the world and knowing that as with coronavirus and H1N1, the pandemic in 2009, the best way to predict what is going to happen is to look at what has happened with other similar viruses.
All right. The next question is for both of you. It comes from Steve Young at CTV News London, Dr. Mackie, and Mayor Holder. Will enforcement be stepped up next week as new businesses start to reopen? Are you increasing enforcement? Mayor Holder, if you'd like to start.
Sure, thank you. We have a specific number of bylaw enforcement operators who, to this point, have shared a combination of responsibilities for both parks as well as businesses. We also have, for those who are concerned about those who may well be, others who may well be breaking the law, we have a phone-in as well as an email approach. And so what we do is we tend to respond either to the concerns that have been verbalized or emailed, and in addition to that, we look at the bylaw enforcement officers and what they do. There won't be additional bylaw officers. I don't anticipate having additional bylaw officers enforced next weekend. But having said it, they will be vigilant, and I expect that they will continue to do what they've always done: be fair but firm, and when it's appropriate, lay a fine. That's not our objective, though. What we are trying to do, and we've tried over the last couple of months, is educate. So the good news is last weekend we had one charge, but we had more than 130 warnings. I suspect there will be some of that as well to be consistent both this weekend and next, although I think this weekend will be a little fresher than next weekend's weather. So that's always the risk too. A long weekend, better weather. People's tendency to, because they're tired of this, to go out and not intentionally break the ban. But having said it, we'll be there to remind folks what is appropriate at this point. But our bylaw folks, I'm confident, will do their job.
Thank you, Mayor Holder. Dr. Mackie?
Well, in terms of what the health unit will be doing, many of our staff have been redeployed, and a lot of the folks that would be, public health inspectors who would be doing inspections are actually now being looked to give guidance to businesses and other locations that are opening up. So our approach will be really about outreach, working with those who need support, and of course complaints-based. If consumers have concerns, they can always bring those to us as well.
All right, thank you very much. All right, the next question, Dr. Mackie, I'm thinking this is for you. It comes from Carrie McKee at CBC. What can you tell us about the person who died? And I'm thinking that is in today's report, there was one death reported. Did he work in healthcare?
Yeah, so we haven't disclosed that sort of level of information. And the reason is once you have age, gender, and that it's a healthcare worker that's passed, you're getting down to the level of identifiable information. And when we have a public health reason to share that information, we would, but at this point we don't. And so unfortunately, I can't confirm whether the person was a healthcare worker or not.
Okay. Well, thank you very much, gentlemen. It looks like we might have an early exit to the virtual media briefing for a Friday afternoon. We are through the questions for today, and I want to thank you both again for your time and for sharing this information with the community. And to those of you tuning in, we will be back on Monday. In the meantime, have a great weekend and have a happy Mother's Day. Thank you, and we'll see you next time.